Though April showers may come your way, they bring the flowers that bloom in May. So if it's raining, have no regrets, because it isn't raining rain, you know. It's raining violets. And when you see clouds above the hills, you will then see crowds of daffodils. So keep on looking for a bluebird and listening for its song whenever April showers come along. Welcome everyone. This is the Janice Thompson Show. This is a SAC production, the Schenectady Access Cable Council. And this is my 5th show since we opened here in the summer of 2012. And we have a great studio here, and we welcome you to watch our shows on Open Stage Media. Go to their public access, and it'll take you to our link, and you can see our scheduling. This should be on probably the early part of May. And I hope you liked our introduction, because we've been having a lot of showers here. And by the time this is viewed, hopefully there's a lot of May spring flowers blooming. And this song was made famous in 1949 by Al Jolson. Some of your older viewers remember him, and I'm sure a lot of the younger ones have heard his name. He performed it at the in Chicago at a stadium there that was famous at that time. And hope you really enjoyed this. Our show today is about senior living, and I have 4 guests, and we're going to give the community a lot of great information. So please stay tuned, tell your friends about us, and welcome. I'm Janice Thompson, and we're going to take a short break. Hi, Karen.
Hi, it's nice to meet you.
Karen Laing, nice to meet you too. You're here because of Melonie, a friend and associate of mine.
Yes.
And I'm really happy that you joined us today on our topic, senior living.
It's a great topic to talk about.
Yeah, and I decided to have you to be our first guest because you're a health advocate, and that's the name of your business.
Yes.
And tell us a little bit about your business.
So I opened a business last year teaching people the health literacy skills. Health literacy is the ability to navigate the healthcare system, the ability to make healthy choices, and then to respond appropriately in a public health crisis as well. And it's a very somewhat complicated set of skills that doctors and our government think everybody has, but there's nobody out there teaching it. So you kind of have to either have figured it out on your own, which isn't easy, or have somebody come alongside and show you how to do it.
So how do you reach out to the community?
I reach out through various organizations. There are insurance companies that hire me, nursing home agencies that hire me, hospitals that hire me to teach to their patients. I teach in schools, I teach in pregnancy centers, anywhere people are gathered that need to know more about how to handle their health.
I'm just wondering at what point you intervene in a situation.
I intervene when the patient or their family asks me to.
Okay.
I will step forward and give a little bit of coaching if I'm asked. I will step forward and do a major intervention. I've gone into doctors' offices with milk crates full of medication and said, this isn't working for your patient. You need to fix this. We need to scale back the medications. We need to make it so he can take his medications. And it's not always a positive conversation with the doctor, but in the end, it's all about their health and their health needs. And if you've given them so many medications that they can't handle it all, you need to do something different.
Now, are most of the patients, clients, do you call them clients?
Clients.
That you work with, are they without dementia? Is there some confusion?
Most people that I work with are otherwise healthy individuals. I have some clients. I have one client who's 20 and facing heart surgery. I have clients that are have dementia, but if I have a client that has dementia, it's much more likely that my real client is their family, and I'm trying to help them navigate the system with the dementia patient. I have a lot of experience in that field because my mom has dementia, so I've kind of walked through a lot of this already, and I'm prepared to walk through the rest of it with her, so it makes it easier to walk somebody else through those hard decisions. And it makes it easier to tell somebody, you have to take away their driving rights, you have to make them live with you or move to a nursing home, because I can live it. They can accept that suggestion from me better than sometimes someone who's an outsider, that they just say, well, you don't understand, I don't want her to go somewhere else, or I want her to live independently.
Yeah.
I say, of course I understand, but this is about her safety, or this is about, his well-being, not about what you want more than anything else in the world. Health literacy is becoming a forefront issue in the medical community, but there are not a lot of places addressing it. And where they are addressing it, they're addressing it from the literacy side. Can people who are learning how to read also learn to manage their health care? I am the only program in the country who teaches people how to manage their health care without having to teach them how to read. I do kind of expect you to learn how to read, although I am working, next week I'm meeting with some of the literacy programs to see if I can put my program into a reading program for New York State.
Wow, well, you seem to really have a passion for it.
I do.
It comes
I do.
across.
I want people to be able
wonderful.
to be healthy, and I think that a lot of times doctors will accuse you of not caring or not being compliant and taking your medications because you really just don't understand the core skills that are underneath it.
Yeah.
It's, sort of like back in the 70s and 80s, we had that, the National Literacy Foundations were doing the Johnny Can't Read thing. If nobody can read, we didn't ask teachers to dumb down the curriculum. We found new ways to teach people how to read. And what we've done with people can't manage their health care is try to dumb down health care instead of teaching people to use the system.
So how many clients do you have?
Right now I have, my clients disappear. As soon as we get them through the cycle, I don't want to keep anybody forever. That's not my goal. Right now I have about 15 active clients and about 25 or 30 that have left, but I'm focusing more on the teaching the classes as well, of just going into places and teaching people how to navigate the healthcare system and how to make good choices without necessarily having to be my client. And that's really where my passion is, because one-on-one, I'll never reach everybody, but in classroom settings, I can reach a lot more people and get them up and functional.
Now, is this something you could do at the county library in the McChesney room?
I could do something like that as well, absolutely. I can teach anywhere that somebody will give me space to teach.
Yeah, because that's free
Right.
for your use. I'm
Yes.
sure you know that.
Yes.
And that's a great place.
It is one of the places I haven't looked yet, but it's been a process of getting people to come out as well and to learn and to listen. So places where people are already there for their healthcare needs makes a faster, easier fit for me. And especially the senior housing options have been fabulous about inviting me in and having me teach, because seniors so often need the health literacy skills, and their family needs the understanding of how the system works and how the aging process works. They have to be able to deal with the fact that their loved one doesn't communicate well with the doctor anymore, doesn't handle their medications any well, really shouldn't be driving anymore. Those are those kind of issues. They need someplace else to live. If there's an emergency, they're not prepared to live in a power outage or to be evacuated in a flood. Those are where the places where I'm teaching the most, because those are the people for whom, if it goes wrong, it's deadly. As opposed to when you're younger, you have more resources and more ability to cope. With seniors, when it goes wrong, they die.
Sure.
They end up in nursing homes permanently disabled. It's a much sadder result to have for something that's early on a small problem. They didn't boil their water during a boil water advisory. Mm-hmm. The rest of us can maybe get through that without more than a few days worth of stomach pain. That can land a senior permanently in a nursing home without being able to live at home anymore. And that's a terrible tragedy for something we can teach them how to manage.
Well, it's so wonderful that you do this.
Yeah, it's a great. I love doing it. I love helping people to be able to live a healthier life.
And it's all about prevention, and
It is.
I'm totally for prevention.
It is. It's all about prevention, and it's all about thinking things out ahead of time.
Now, how would you like everyone that wants to contact you reach you?
So I have a website. It's called Your Health Advocate, but you have to put little dashes between it, .com. Or they can email me at yourhealthadvocate@hotmail.com. Or if that's just way too much to type into the computer system, they can call me. My number is 518-881-6405.
And that'll be good because there are a lot of people, not just the older,
No.
that don't have a computer and
Right,
are
yeah.
even computer illiterate.
Yeah.
So-
I'm because I often teach classes, I don't always pick up the phone. So if you call my cell phone number, please leave a very detailed message about what's going on. So I make sure I call you right back, and I have some resources immediately available to help people. So if I have to spend the first half hour on the phone figuring out what's wrong with you, it makes then we're kind of not as quick about getting answers. Sometimes I have to do some research when I'm dealing with a new area, but I research well and I research quickly. So if you can leave me a message and say, this is what's going on, or this is what my doctor thinks, or I don't like what's going on here, or I'm worried about my mom, those things help me to figure out earlier on where to go for resources before I call you back.
Wonderful. Well, you sound like you're a valuable resource for our community.
Thank you.
So I hope
so.
I hope everyone's enjoying this on senior living, and I hope you'll stay for a little refreshments after, and
Sure, I'd love
we'll get
to.
ready for our next guest.
Okay, thank you.
Thank you. Hello, Melonie.
Hi, Janice.
We have Melonie Pratt here. She's a senior housing specialist. Her business is called Choice Connections.
Mm-hmm.
And you do work with Karen in some capacity. I have a little cheat sheet here that will help me not miss anything that you want to cover. We are free to the seniors and their caregivers?
Yes. Choice Connections is a free referral service. So we help families find senior housing. They give us a call and we take a needs assessment. Usually we have to talk about what the senior can afford in terms of senior housing. And then we make recommendations as to which homes would be a good fit, whether it's independent senior housing or assisted living. We do make referrals to nursing homes. We help families decide which nursing homes they would like to go see and consider. But primarily we work with the family who are looking to just downsize from either their home or their apartment to a senior apartment or assisted living. And that is a free service for the families.
So how do you make yourself known? How do you get your message out?
We are referral. We network with the community. We try to get involved with the community as much as possible. And like Karen, I really try to find resources for seniors that especially if they are not going to move to an assisted living community or make a move at all, I want them to know what is out there for them to either stay in their home or their apartment. So I try to work with all the local agencies, Office for the Aging, Catholic Charities, anybody that, CDTA. If the family is having an issue, I want to have someone to tell them to contact if I'm not the right fit. So that is kind of the basis of Choice Connections is we really wanted to help the families of elderly seniors primarily in their very stressful time, because making a move is very stressful.
It's stressful for anyone, really.
It is.
And it's harder for the seniors, definitely, or anyone who
Absolutely.
has an illness.
And primarily people that are moving to assisted living are in some type of crisis, primarily. So that is where I get the phone call, and it's usually the son or the daughter of an elderly senior, and they tell me everything that's been going on. It's usually quite a long story of, hospitalizations, different types of, situations that they'll tell me where the senior was in danger, whether it was, driving when they shouldn't be, or because of their dementia, let's say they overboiled the eggs, and they exploded, and just a lot of different stories that they've been dealing with a lot of stress, and now they're ready to make a move for the safety of the senior. Sometimes the seniors themselves will contact me, though, and they are just ready. They're ready to not cook anymore, they, not do their laundry anymore, not have to worry about the home.
There are a lot of people younger than that don't want to do it either.
And there are actually, yes, there are some senior independent living communities that are beautiful, and some provide 3 full meals a day. Others might have a meal system where you have a certain amount of points that you can use. And so, yes, I'm actually touring tomorrow with a woman who's 66, but she is having some health concerns. And so she's thinking ahead. She's thinking down the line, and we're going to actually go see a continuum of care community. So this is a community that has independent living, assisted living, and a nursing home on the same campus. And so for her, that makes sense to her, because she's saying, I have one son, he doesn't live here in town, I'm looking ahead, I've already dealt with a lot of illness, I want to be somewhere where I'm not, I hate to use the word burden, but a lot of seniors actually use that word with me. They'll say, I don't want to be a burden on my family. But I think what she's saying is, I don't want to have to rely on other people. And in assisted living, if she were to get to the point where she needed assistance with bathing or dressing, that would be provided by people who are trained to do that kind of work. So I think that's really smart of her, but that is very much the minority, that people are looking down the line to what they might need in the future.
Yeah, most people don't have that long-term vision.
Right.
Now, what are some of the communities? You're having like an open house soon?
Oh, yes. On May 8th, we're having a parade of homes. Holiday at the Atrium is an independent community in Scotia that has offered their bus. We're going to pick up seniors from the Scotia Glenville Senior Center at 9 a.m. on May 8th. We're going to head out to Glen Eddy for breakfast. Then we'll go to Kingsway. We're going to have an activity there with their independent seniors. And from there we'll go to Wynwood of Niskayuna and have lunch. And then we'll end the day at Holiday at the Atrium, where they're going to raffle a really nice raffle prize. So it's going to be a great day. I actually have 18 seniors signed up already, and I only have room for 20 on the bus. So the Scotia Glenville Community Center really, they gave me a call primarily because I got an ad out in their newsletter. But I'm also working with the Niskayuna Senior Center as well.
They have a good one there too.
Yeah, so I have about six seniors from the Niskayuna Center as well.
Mm-hmm.
So basically we're going to see the homes in Schenectady, most of the homes in Schenectady. And they're all different. They're all very unique. A senior would have to spend probably 2 days really getting all the information, going on the tour and getting all that info, because an individual tour can take about an hour and a half. And what happens is, especially if you think about, say, maybe a 90-year-old woman, she calls the local adult home. She's heard about it on the TV or radio, right? And she makes the appointment, goes in, so she's all that effort, all that time just to get there, and then tours and finds out that for one reason or another it's not going to be a good fit for her. And a lot of seniors get very discouraged at that point.
And she's going there on her own,
Well, I'm
or
just
with
saying,
a family member
maybe?
maybe?
For an example, yes. A lot of families will call the local community that they've heard of and really not know all the details until they've toured. So my service helps people to understand financially if they can afford it
Ahead of time.
and then medically, because there are certain things that now we're not talking about independent living, we're talking about assisted living, this realm. There are certain things that some homes can do, some care that they can provide, and other homes cannot. So I am, especially if it's someone with a lot of medical need, I would really recommend the homes that were appropriate, not homes that, maybe they could only live there a few months, New York State Health Department regulates assisted living. And there are some assisted living that have enhanced licenses. So they actually choose which of the what care aspects they want to cover when they apply for their enhanced license. So I know which homes can, for instance, help with 2 people. They call it a 2-person assist. They can have 2 people helping that senior in and out of bed and in the bathroom, in the shower. Other communities, they could have a 1-person assist. So if someone calls me and their loved one is really having to, be lifted out of their seat, most of the assisted living communities are really not going to be a good fit. So they really could spend a day making phone calls trying to find which community to go to.
So you can really help make it a quicker process because you have this information
right
ahead of time for them.
Yeah. So basically save them time and stress. The assisted living community themselves would make the determination whether that person was appropriate for them. They would send their nurse to screen the senior, or the senior would come to the community for the screen. So ultimately it is their decision whether this person's appropriate for them, but I do know their guidelines. And what I do with families is once we narrow down which homes they would like to see, I will schedule appointments for them to tour. That is really the first step. They need to see the community. After they've toured, I continue to work with them. Do you want to see another community? If they don't, if they want to just sit back and decide on which community, then they give me a call when they've made the decision, and we set up that screen, because the next step would be for the community to meet the senior. They might ask them to demonstrate getting out of their chair, that kind of thing. And if the community is agreeable, which most of the time they are, the senior would have to go to the doctor for a physical. That then the doctor would fill out all the medical paperwork for the community, and it's really could happen within a week or so.
So on May 8th, what are the communities that you're visiting?
Glen Eddy in Niskayuna. Glen Eddy has independent living. They also have an assisted living community there. Then we'll go to Wynwood. Wynwood is an assisted living community with an enhanced license. And they are a resource really in the community in that they can provide that 2-person assist. And many other things as well. And then we'll go to, we're going to go from Glen Eddy to Kingsway,
Oh, Kingsway.
And then from Kingsway to Wynwood. So Kingsway has independent living, assisted living, and the nursing home. But we're going to visit their new independent living community called Kingsway Manor. And
I hear that's lovely.
It is. It's beautiful. It really is. They have 2 independent, well, I should almost say 3 independent communities there. And they're all a little bit different. So I really go over that with families. as to what prices one of these communities is versus the price of another. And
these are all private pay.
they are. Primarily assisted living, independent senior communities are private pay. There are some that would take Medicaid, though. There's a community in Troy, and some of these communities, you could go in paying privately, and as your funds run out, they would convert you to Medicaid. Or if you already have Medicaid in place, or at least a Medicaid number pending, they will take you on with your Medicaid.
Mm-hmm.
And there's other homes.
Well, I'm surprised about that. I didn't know
Yeah,
that.
yes. That's actually a community in Troy called the Pines.
Mm-hmm.
So there are other communities that do take Medicaid as well. So I do help a lot of families to make that decision.
Very nice. I know you wanted me to mention to you not to forget to talk about the veterans benefits.
Oh, yes, thanks. A lot of people do not know about a pension that they could apply for either as a widow of a veteran or as a veteran themselves. It's called Aid in Attendance, and I help families to understand aid in attendance. It could be up to $1,000, a little bit more than $1,000 for a widow of a veteran, paid to her per month if she qualifies for this pension. Or the veteran himself, it's, I should have gotten the numbers exact, but around $1,700 for a veteran. So the aid and attendance pension is specific for seniors who have medical needs. So if you move into assisted living, that is considered a medical need, that your doctor signs the paper that you need assisted living.
Mm-hmm.
So there's a lot of paperwork. There are some financial limits as well. There's asset limits and there's income limits. So, but when you move into assisted living, you can deduct the cost of that community. It depends on which community. Some of them you can only deduct some of the cost. But in a licensed assisted living community, you can deduct the full cost of your rent. And then you qualify income-wise because the cost of the rent usually would be most, if not all, of your monthly income.
Now, does the veteran have to be living, or can the veteran
Well,
be
a widow of a
deceased?
veteran could apply. So the veteran would be deceased. And the veteran, yes, himself would have to be living.
Yeah.
Yes. And then there's actually couples that there's another rate for couples if two of them are going into assisted living. So I do refer, though. I don't consider myself the expert on the pension. I refer to the experts. But I help the families understand how it can help them to afford assisted living.
Mm-hmm.
Because that pension, if say it was a widow of a veteran, say she has an income of about $1,500 a month, she would be getting another $1,000 a month just right to her account, and that can help either pay the full rent possibly, or help so that she's not using so much of her savings.
That can make a big difference.
Yes, it does.
Definitely.
But assisted living is, primarily seniors have to use their income and then also use their savings to pay for the cost of
Sure.
that. So I really am helping families decide, is this a wise choice, first of all, and how long could they stay in a private pay assisted living
Sure.
with the
you can
resources that they have.
give them a lot of answers.
Right.
What is the best way for people to reach you, Melonie?
My phone or my email. My phone number is 518-894-2443. My email address is melonie@choiceconnections.com. And we do have a website. It's choiceconnections.com /Capital Region.
Well, you're very well spoken on this topic,
Oh, thank you.
as well as Karen.
Mm-hmm.
So great information from both of you so far. I can't wait to see what's ahead. We're going to be seeing Margo in a few minutes. So thank you so much for all this information. You were a great help getting our community in tune with what's out there, because so many people are confused and don't have the answers, or they don't know what to do and they get stuck. And they don't have families lots of times to help them.
Yeah.
That's another thing.
It is.
That's
often the case. I'll get a call from someone, a son or a daughter who lives in another state, and they've come here because their mom or dad was in the hospital. And so in that scenario, I can work very quickly to find some, to set up appointments, say they're here for a week. And they have to be back in Arizona next week. So I can hurry up and set up their tours and get that process going. And then I can work with, there's usually someone locally that would be willing, whether it's a neighbor, a cousin, someone local that I could work with after they've gone home. But at least they've seen a few communities. They know the pricing.
On-site is the best way to do it.
It really is with senior communities. To walk around, to see the seniors, to even go for lunch.
Sure.
And try the food.
Because if they don't like the food, they won't want to stay there. That would be
most
very
of the
important
time,
to me.
if I tour with a son or a daughter, and they want to pursue that community, usually they'll bring mom or dad back for lunch. And I always recommend that. They get to meet the other seniors.
That's so important.
Yeah.
And the social aspect is going to be very important.
Yes.
So if they like that mingling, that's really important ahead of time.
It's an adjustment. It is.
Sure.
I mean, if you've lived alone for, so many years, most people, though, after, say, a month or so are, buddy-buddy with someone, going to lots of activities. They don't see themselves doing that at first, but living in community with other seniors is very healthy.
I have an aunt that's over at Kingsway, and she loves it. And she is so social.
Right.
And she's in her 90s. She was social before, but she lost her husband, and they were married like 60 years. Yeah. And she's just really adjusted over there. And she wants me to come over and have lunch with her. And,
right.
And
assisted living is considered independent living. So you could take her out to lunch. You could have her come to your house for the weekend. She could come and go as she pleases. But any care needs that she may have, whether she's confusing her medicine, they would take care of that. If she needed some assistance in the bathroom, in the shower, maybe she just couldn't do a button or two or tie her shoes, they would do that for her. So all those difficulties in living alone are taken care of, but they are able to live very independently.
Well, thank you today
for
being here and gracing us with your presence and your information. You're watching the Janice Thompson Show, and you can also watch us on our new website, sac.tv. And I understand that it will be on there before it's over at OSM. So I failed to mention that earlier, and I want to make sure everyone knows about our website. It's wonderful. I know my 4 previous shows are on there, and several other producers that do shows with us. You can see all over the world when you go to sac.tv. Thank you. Hi, Margo. Margo Janack.
That's correct.
You are the Manager of Marketing and Communication for CDTA. A very, very valuable part of our segment today on senior living, transportation. People need to travel to some degree, so CDTA is a very important part of our community. I see the buses all along. I don't ride the bus. I like buses, but I do have a car, so I probably should just ride a bus occasionally to experience it
Yes,
locally.
Yes. First of all, I want to say I'm pleased to be here on behalf of CDTA
Thank
to tell
you so
about their
much.
services. And Janice, I will personally escort you on a bus if you'd like to
Would you?
try
We
it
could
out.
take a tour,
Yes.
do a bus tour, huh?
Let's do that.
We could go to one of Melonie's communities.
I'm here because we want to talk about accessibility, not only for seniors but for everyone. And as Melonie and Karen had discussed earlier, they often refer seniors to CDTA when they've decided to give up driving, and they still want to remain independent. And this is a way for them to do that. We have an extensive system. We serve Albany, Schenectady, Rensselaer, and Saratoga counties, and we have over 55 routes throughout the system that connect everywhere you want to go. And we invite seniors to take a look at us if they haven't tried us before, and we make it easy for them to do that. And I'm going to start with, we have travel trainers. Now, I said I would personally escort
Really?
you, but we do have travel trainers who are representatives of CDTA who can take an individual unfamiliar with our service and personally escort them on routes from where they would like to go, and go take them through the entire process until they're completely comfortable with it.
And I never heard of that. That is a great service.
It is, and it does get utilized quite a bit, and we try to get out there in the community and let people know. For example, we're at the Colony Senior Services Maintenance Fair just the other day with Karen, and we let people know that this service is available for them. But seniors can also take advantage of our STAR service, and what STAR means is a special transit available by request. The STAR service is a paratransit service who people who have disabilities and unable to use a regular route service can use this to get around. And basically, it is a door-to-door service. It's a reservation service. They call a number in advance. And before, though, they can participate in STAR, they need to qualify for it. And that would require doctor verification and filling out forms and whatnot. But many people do use this to get around for their medical appointments, religious service, shopping, whatever they need to do to conduct their daily activities in life.
Now, what is the rate for that?
The rate for STAR is $2.50 a ride. People can also get a discounted packet, a STAR ticket packet, and that's $13 or $30 for 13 tickets, rather.
And this is something that they get. It gets mailed to them. Do they have to come in and buy them? How do they get the tickets?
They can come into our sales office, or if they are registered online, they can receive them through the mail.
Where's your office?
Our main office, sales office, is located at 85 Waterville Avenue in Albany. And seniors also qualify for half fare on a regular route system. And the regular route system is $1.50 per ride, or if you get another swiper pass, it's extra discounts. For example, a 7-day rolling pass, normally $65, and seniors would be able to get it for half that. They just either need to show their Medicare card, or they would get a photo ID, and you would get those at your Department of Aging or the sales office.
So they could just get on a bus and show that to the driver?
They could get on the bus, show their Medicare card or the half-fare ID photo card, which is pretty easy to get. At this point in time, it's only $3, and they get half-fare anywhere they would like to go.
So your ridership is increasing.
Yes, we had one of the best fiscal years ever. Since almost about 30 years ago. Our ridership has topped, it's close to 16 million. And we haven't seen those numbers since 1985. So we are doing great. And we attribute that to a lot of things. There are more demand for our services. And we have introduced many innovative programs and services, including the Bus Rapid Transit, our Universal Access programs, which we work with schools and businesses to get unlimited ridership for their employees and or their students. These things are really taking off, and people are starting to take a look at CDTA services. People who've never looked at us before, especially in this economy. They're realizing we are the affordable way to go. You don't have to worry about parking.
Certainly a lot less expensive than a car.
Absolutely.
I mean, no comparison.
Yeah, studies show that you can save up to $10,000 a year riding the bus as opposed to having a car. And of course that includes the maintenance and the insurance and the gas and everything that goes with it. But that's substantial, and that can mean a lot to people who would rather use it for something else, living expenses.
Sure.
Transportation is the second highest cost in anybody's household budget behind your house. We have a lot of information at our website, cdta.org, and also if you're interested in STAR and you think you might qualify for STAR service, we do have an easy guide that they will send out to you. Our STAR number is 482-2022. And give us a call and see if we can help you out, and I'm sure it'll be a lot easier than you think it is.
Now, is there a lot of government money that you get? Is it about how much? Is it mostly subsidized by the government?
We get state and federal funding. It's about 40% state, I guess another 10% federal. But now with the service being in more and more demand in our region, it's harder for us to meet the demand within our budgets.
Sure.
And so we are trying to see if we can advocate for more transit funding to support these services, because we really don't have a reliable source that we can count on every year. I mean, obviously the state and federal is reliable, but given the certain circumstances now, it's been relatively flat over the last couple years, and we have struggled to try to keep up with service demand, and that's not going to change anytime soon.
No.
With a baby boomer population growing as fast as it is, we are going to see more and more people wanting to ride the bus so they can remain independent and to get where they want to go, to make their lives productive.
Do any of the buses have bathrooms?
Our commuter bus has bathrooms. We have a bus that operates from Saratoga County to downtown Albany, and that's our Northway Express bus. And they have restrooms aboard because they are longer trips. The shorter buses do not, because oftentimes you're not on them as long as other buses.
I was wondering about that. Because the last bus I took, I went to New York, and of course it had bathroom.
Yeah, so those are coach style buses.
Yeah,
and
that was great. That was a great trip. I do like the bus. Well, thank you for all that great information. And if you want to give your number one more time.
Sure.
The toll-free number.
CDTA customer service number is 518-482-8822. CDTA.org.
Thank you, Margo, so much for being here today.
Thank you. I appreciate the opportunity.
Hi, Jim.
Hi, Janice.
Jim Salengo.
Yes,
we
thanks.
met recently at
did.
the Friends of the Library dinner at the college. It was wonderful, wasn't it?
Yes, it was a great event.
Yeah,
it
and
really
you were
was.
on stage for a good half an hour
Yes, I was
talking
the
about all the
keynote
accomplishments.
speaker, if you will.
You
Yeah.
were, and you did a great job. All the accomplishments the Downtown Schenectady Improvement Corporation has done for Schenectady.
Sure.
And
And
I
all
was,
the great things happening down here in general.
and
Sure.
what you're planning on doing, and there were a lot of things that you covered.
Sure. Well, there's a lot,
There's a lot going
in
on.
downtown.
It's
an
exciting,
exciting
isn't
time.
it?
It really is.
Yeah.
And we're in the heart of downtown right here. So.
We are, and yeah, we love our new studio here.
Yeah, it's
We're
great.
at 34 J Street, so we ask people to come and visit us. We are having a ribbon cutting ceremony on May 7th at 11 a.m. It will be in the paper. This is with the Chamber of Commerce. A lot of special people will be here, and not so special people.
We'll be here, and the community is invited to be here, so that'll
Anybody
be a
can
great
come.
time. Sure.
So we're looking forward to that. I'm in charge of the food, so hopefully that'll be a draw. So what can you tell our seniors, since this is a show on senior living, what they have to look forward to in their later years, part of the aging process, which we are all going to experience if we are blessed with living a healthy productive life.
Mm-hmm.
What is your suggestion for our seniors?
I think my biggest suggestion, I mean, speaking in terms of what I do for a living and, knowing all the things that are happening in our community, is to encourage our seniors to not be afraid, to get out there and experience all the great things that are happening. Because in terms of downtown Schenectady, many people know that it is really coming along. It is a tremendously different place, and it's an exciting place than it was even 10 years ago, 20 years ago. And the things that I would like seniors to know is, as Margo said a few moments ago, it's very, very easy to get here. Whether you take the CDTA bus, which makes stops throughout downtown by some of our most visited attractions or restaurants or places like that. But also if seniors still drive, or if they have
And
family
a lot
members.
of them do.
Yes, a lot of them
drive.
still do. Or if they have family members who can drive them. Sometimes affordability is also extremely important. And the thing that we have in downtown Schenectady is free parking in our public parking lots. If you come during the week, you can park for free for 2 hours. And whether you would like to just take a walk, or you'd like to go to one of our events, or you'd like to visit some of our shops, that's a really nice benefit for somebody who perhaps is watching their budget. And there's a lot of public parking in downtown. Sometimes it's, if you haven't been down here in a while, you might think, well, maybe there's not as much, but there's actually quite a bit. It's improved. There's
Definitely.
quite a bit of lots. There's a large public parking garage, and they're all very accessible to a lot of the shops and attractions that we have down here. So in terms of that, there's really no
excuse.
obstacle, no excuse to actually to come out. And I could say the same thing for a lot of communities in the area in general. Of course, speaking specifically about downtown Schenectady, but CDTA operates a lot in downtown Albany, downtown Troy. And the other thing I just want to talk about is some of the things that seniors can do down here. They may not realize there are a lot of very popular events that you can come to at no cost. There's a great concert series that we have a lot of our seniors in the community that come out to starting in June.
Oh, the
It's called
Jazz on J.
Every Thursday afternoon on J Street, which is the pedestrian walkway with a lot of great shops. That's at lunchtime every Thursday from June through August. And if you haven't come down for that, it's a wonderful afternoon, beautiful music, different performer every week. That is something to look forward to. Another great resource is our library. We're the home of the main branch of the Schenectady County Public Library, and all week long they have free movies, they have lectures, book signings, lots of things. The library is a wonderful resource, and we've got one of the best ones, largest ones down here. If you have grandkids, they just opened up a brand new children's wing that is fantastic for the books they have and the programs they have and the space they have. So there's really a lot of festivals. I mean, in July, there's the Summer Night Festival that you could come down to, listen to some great music, eat some food. So if cost is a concern, there's a lot of opportunities to come down here at very low cost. If you would like to spend a little bit of money, there's a lot of opportunities to eat at very simple restaurants that offer good gourmet sandwiches all the way up to nice, fine gourmet dining. Downtown Schenectady
Big
is
variety.
really big variety down here. So that's something. And then, of course, there's Proctor's Theater.
Of course,
There's
the hub.
There's the Schenectady Green Market every Sunday from 10 a.m. to 2 p.m.
And that's been growing too.
It's growing. About 3,000 people come down every week. So that's just something, even just to walk around and talk to the vendors. And then one of the other things I guess I wanted to talk about a little bit was, there's all these things you can do that are program related, like going to a concert or going to a show. But I would also encourage our seniors to look for opportunities to do something that they want to do and volunteer in the community. I know at our organization we have some committees, and they're staffed in large part by seniors in our community, and they have way more energy than I could ever dream of having. We've got a big fundraiser that we do every fall, Yeah, called the Building Block Party, and these folks are amazing. They are connected in the community. They help out. They reach out to some of our businesses to get them involved, and it really makes them feel like an important part of the community, and they're making an impact. So that's one of the things I would certainly encourage people, our seniors, to look to do as well.
Now, how should they contact you? How will they know about this?
Well, they can contact us because, fortunately, we work with a lot of the businesses and we work with a lot of the organizations where we might be able to provide an idea of where a resource or an opportunity would be. So we're the Downtown Schenectady Improvement Corporation. We're located right at the corner of State Street and Ferry Street at 143 State. Our office is right at street level, accessible. We can, on the phone, we can be reached at 518-377-9430. Or we do have a website, which is downtownschenectady.com altogether, which is pretty easy to remember, I hope.
Yeah, so anyone watching this can give a call.
Sure.
I know that you're an option on there on that. I think is it Beth?
At our office?
Yeah.
Gail? Or
There's Gail, and then there's
we have Becky, Colleen,
Becky.
and Gail in the office.
I had Becky on as a guest.
Yes, all in our office.
So they could talk to any one of you people.
Absolutely,
and,
absolutely.
If they have questions and.
Right. And I'm also, just one quick more minute, I'm also involved with a local organization called the Stakeholders. And that they've actually become a regional volunteer center. And they provide opportunities to match people interested in certain areas with organizations that need help.
Really?
Yes.
Well, that's
so
a great resource.
if a senior is computer savvy, or if they have a family member who is, if they go to thestakeholders.org, you can easily fill out a profile there for free that says, I would like to volunteer. Here's the things that I'm interested in. And then the Stakeholders has information about not-for-profit organizations, and they might be able to make a match on their behalf. So that's
wow, that's a
another
great
opportunity.
service. It just made me think, too, that a lot of seniors, believe it or not, may be willing to learn the computer. They just need a little help, okay?
My sister and I just gave my mom and dad an iPad for Christmas, and now they are on the internet.
Well, they can go to the library also,
They
and they
can.
have free computer classes, and they have them ongoing.
Yes.
And
Again, that is a great resource, both
I mean,
for
it could open up a new
education
world
and
for them
for
that
social.
they hadn't experienced, and they just need a little help.
Absolutely.
Like we all do at some time for some things. So.
But it's exciting in the same way, just to actually try something new
Right.
and get used to it.
I mean, it is the way of the future, so we need to embrace it.
Yep.
So thank you. Is there anything else you needed to say? Because I think you covered a lot in a short time.
Sure. Well, again, I just to go back to the beginning, I really would encourage seniors to really get out and experience all the great things happening, not only just
Especially in the
Schenectady.
nice weather.
In the nice weather, which
that
is
is
coming up
upon
finally.
us,
We've all been
finally.
waiting for it. But there's a lot
Definitely.
out there. It's accessible. There's a lot of opportunities. Just really enjoy it.
Well, your leadership is showing, for sure. I'm not sure how long you've been
5
the
years.
head, but you've done a lot, and it shows. So thank you for
Thank you. It's a
great
great
leadership
partnership down here.
and the team that you work with. And I want to thank all my guests today. You all were well-spoken and really helped our community because people need to have their awareness raised. So thank you again. I want to close our wonderful show today on senior living with 3 stanzas of a poem that I think is really beautiful. It's called One Today, and it was written by our inaugural poet, Richard Blanco, and it's 12 stanzas, but I'm just going to read 3 of them, and I hope you enjoy it as much as I do. I did read it in February on Ann Perillo's show, and when Richard Blanco appeared at Union College, he read the entire poem, so I hope you like this. One sun rose on us today, kindled over our shores, peeking over the Smokies, greeting the faces of the Great Lakes, spreading a simple truth across the Great Plains, then charging across the Rockies. One light, waking up rooftops, under each one, a story told by our silent gestures moving behind windows. One sky, toward which we sometimes lift our eyes, tired from work, some days guessing at the weather of our lives, some days giving thanks for a love that loves you back, sometimes praising a mother who knew how to give, or forgiving a father who couldn't give what you wanted. We head home through the gloss of rain or weight of snow or the plum blush of dusk, but always home, always under one sky, our sky, and always one moon, like a silent drum tapping on every rooftop and every window of one country, all of us, facing the stars. Hope, a new constellation waiting for us to map it, waiting for us to name it together. Thank you for tuning in today, and I'll see you soon.